The interventions that are used in micro program are meant to help a client who has some imbalances and non-functional movement patterns in their squat. And the first thing I do when I evaluate my client is do a postural analysis and a dynamic movement assessment of their squat. And based on those findings, such as if pronation or knee valgus is present, then I would do a range of motion test on the overactive muscles and manual muscle test on the potential underactive muscles to evaluate which movements and exercises can be most beneficial to my client. So the first exercise that I would have my client do is focus on inhibiting the lateral gastrocnemius. And what they do is they'd use a foam roller and place it underneath the client's gastrocnemius. They'd roll it out till they find a spot of tension and hold it for 30 seconds, and they would do that for 3 times. Then the next thing I would have the client do after inhibition of that muscle is completed is I would have them lengthen the gastrocnemius by a calf stretch, and then I'd have them bend the leg behind them in the calf stretch to lengthen the soleus, and they do that 3 times and hold it for 30 seconds. The next stretch that I would have them do to lengthen another overactive muscle is a hamstring stretch, and I would have them bring their leg straight up in front of them with both legs extended, and then a bit medially in order to target the long head of the bicep femoris. The next thing I would have the client do are toe raises. This gets into the strengthening of the underactive muscles. Toe raises will strengthen the anterior tibialis, which is typically seen in people that struggle with pronation and knee valgus. So if that was evident in the assessments, then and that's why I'd have them do those toe raises. And they do 3 sets of 10. And the next thing I'd have them do is a side-lying hip abduction. This will target the gluteus medius, which is a stabilizing muscle for the lumbopelvic hip complex and lower extremities, and is typically an underactive muscle in lower extremity syndrome. The next thing I'd have them do is a donkey kick, which will target the gluteus maximus, and because eccentric movements create more force and are important to the biomechanics of movement, I would have them do an eccentric heel tap on a 4-inch block, and this is going to strengthen the patellar tendon, and it will strengthen and help with things like patellar tendinopathy. The last thing I would have the client do is more of a dynamic exercise. I do an anterior step up with a single leg balance. This will not only focus on stabilizing and maintaining balance throughout movement, but it will allow the practitioner to further evaluate and see what other things the client needs to assess to improve their movement of a squat.